Bag and mask ventilation, first 30 seconds. Ventilation of the lungs with a bag and mask is the single most important step in resuscitation of a newborn. In this video, we will show you the steps and correct way of ventilating the baby with a bag and mask. If after providing initial steps the baby is not breathing, then start ventilating with bag and mask. First ensure that the airway is clear. If there are any secretions, again do suction. First from mouth, then nose. So there is no obstruction in ventilating the baby. You should position yourself at the head end of the baby or on the side of baby to allow you to hold the mask onto the baby's face comfortably and have an unobstructed view of the abdomen and chest. Methods to place mask onto the face. Select appropriate sized mask. For preterm babies, select 0 number, and for term babies, select 1 number mask. The mask should be placed on the face so that it covers chin, mouth and nose. Remember, mask should not cover any part of the eyes. The mask usually is held on the face with thumb and index finger encircling the rim of the mask in a shape of letter C. Apply the mask by cupping method. With remaining fingers, bring the chin forward to maintain a patent airway. When placing mask, you should be careful not to rest your fingers or hand on the baby's eyes. Also ensure that your fingers are not pressing the windpipe. If the rim of mask is soft, then hold the mask from its stump and apply as shown in video. After applying the mask correctly, start ventilation by squeezing the bag. Adequate pressure required to squeeze the bag should be just enough to produce gentle chest rise as it happens in normal breathing. Breathe 2, 3, 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 breathe 2, 3. If chest rise is not adequate after 5 breaths, then you should immediately take steps to ensure chest rise. Reasons for inadequate or absent chest movements are: 1. The seal is inadequate. 2. The airway is not open or blocked. 3. Not enough pressure is being given. If there is no chest rise after initial 5 breaths, take the following 2 corrective steps. First step is reposition the baby with slightly extending the neck. Reapply the mask to the face and try to form a better seal. The most common place for a leak to occur is between the cheek and bridge of the nose. Now, again start ventilating the baby. Breathe 2, 3, breathe 2, 3, breathe 2, 3, breathe 2, 3. If after 5 breaths the chest is not rising, then take second corrective step. Second corrective step is check the mouth for secretions. Suction mouth, then nose. Increase the pressure by squeezing the bag with more force until there is visible movement of chest. Breathe 2, 3, 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 Is the chest rise normal?
Yes, chest rise adequate.
If adequate chest rise is present, then continue ventilation for 30 seconds. During ventilation with bag and mask, breaths should be delivered at a rate of 40 to 60 per minute. To help maintain a rate of 40 to 60 breaths per minute, try saying breathe 2 3, breathe 2 3 as one ventilates the newborn. Squeeze the bag when speaking breathe and release the bag when speaking 2 3. Ventilate the baby for 30 seconds. Breathe 2 3, 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 breathe 2 3. After providing adequate ventilation for 30 seconds, assess the baby for breathing. If the baby is breathing, then gradually reduce the rate of ventilation. Breathe 2 3 4. Breathe 2 3 4 5 6. Breathe 2 3 4 5 6 7. Breathe and remove the bag. Again assess whether the baby is breathing well or not. If the baby is breathing well and ventilation is provided for less than 1 minute, then shift the baby with mother for observational care.